Hello, my topic is informed shared decision for patients with aortic stenosis. Definition. What is aortic stenosis? Is a tightening of the aortic valve in the heart. This valve lets blood flow from the heart to the rest of the body. And in aortic stenosis disease, it doesn't open properly and may also leak blood. It commonly happens when the valve did not form completely.
Aortic stenosis is a heart valve disease that affects as many as 1.5 million Americans. It becomes more common with age, affecting 1 in 10 people over the age of 75. Left untreated, severe aortic stenosis leads to decreased quality of life, heart failure, and even death. Aortic stenosis occurs when the aortic valve, the main outlet for blood being pumped from the heart to the body, becomes abnormally narrowed. In older adults, stenosis is typically caused by wear and tear and the gradual buildup of calcium deposits that stiffen and narrow the valve, keeping it from opening properly. As the valve narrows, the heart has to pump harder to push blood throughout the body, and this can lead to symptoms like fainting or nearly fainting during exertion, chest pain, weakness, and fatigue. While not all aortic stenosis patients experience symptoms, 3 out of 4 older patients with severe aortic stenosis do. However, many dismiss these warning signs as normal aging. This often leads to the underdiagnosis of aortic stenosis. Those that experience aortic stenosis symptoms have diminished quality of life, making everyday activities like climbing stairs and walking increasingly difficult. If you or a loved one has aortic stenosis symptoms, it's important to seek medical attention promptly. Simple tests are used to diagnose aortic stenosis. Aortic stenosis produces a very distinct heart sound, a murmur, and is usually detectable with a stethoscope. But other tests may be necessary. Over time, aortic stenosis strains the heart, causing the heart muscle to become thicker, weaker, and scarred. Without treatment, severe cases lead to heart failure and death. Medications can treat chest pain or other symptoms, but none can reverse aortic stenosis. Only repairing or replacing the defective valve will eliminate aortic stenosis. Without surgery, 50% of patients with severe aortic stenosis don't survive more than 2 years after the onset of symptoms. Aortic stenosis treatment typically requires aortic valve replacement surgery, or AVR. This surgery replaces the defective valve with a mechanical or tissue valve. AVR improves quality of life and increases survival in most patients. But those at high risk for surgical complications may not be good AVR candidates. Fortunately, recent medical advances give new hope for those who cannot tolerate more invasive surgery or are at high operative risk. TAVR, or transcatheter aortic valve replacement, is a new technique in which a valve is placed by inserting a catheter through an artery in the leg and threading it to the heart. This procedure is minimally invasive and does not require the chest to be opened. There are risks associated with TAVR, including stroke and damage to leg vessels. Aortic valve replacement is still the preferred treatment for most aortic stenosis patients, but TAVR represents a potentially life-saving alternative for those who cannot tolerate more invasive surgery. If you or a loved one has been diagnosed with aortic stenosis or is experiencing symptoms of aortic stenosis, talk with a healthcare professional right away. Get prompt medical attention for fainting or nearly fainting during exertion, chest pain, weakness, and fatigue. And remember, aortic stenosis is a treatable condition, and older age is not a barrier to valve replacement. Brought to you by the Alliance for Aging Research, with support from Edwards Life Sciences.
Aortic stenosis. Stenosis progression is associated with the increase of blood flow upstream through the left ventricular outflow tract of happens for many years. Only 10% of patients with aortic stenosis advance to hemodynamically important Aortic stenosis. Common causes of aortic stenosis is valve calcification. This was previously considered normal consequence of a GIM. Application in medicine. When the opening of the aortic valve is constricted, blood is not able to be pumped adequately, and this makes the pressures in the left ventricle increase. First, the left ventricle compensates with thickening its walls for maintaining adequate pumping pressures. After this, the left ventricle dilates more than usual, and its walls become too thin, and systolic functions starts failing.
Treatment for aortic stenosis depends on how far your disease has progressed. If you have mild or moderate aortic stenosis and are experiencing symptoms, your doctor may monitor you and prescribe medications to help relieve any symptoms. Eventually, if your aortic stenosis becomes more severe, the only effective treatment is to replace your diseased valve. There are two effective treatment options for patients who have been diagnosed with severe aortic stenosis: transcatheter aortic valve replacement, TAVR, sometimes called TAVI, or surgical aortic valve replacement, SAVR, or most commonly called open heart surgery. TAVR is a less invasive procedure than open heart surgery. The TAVR procedure uses a catheter, which is most commonly inserted through a small incision in the leg, to implant a new valve within your diseased aortic valve. For patients who have been diagnosed with severe aortic stenosis, TAVR may be an option depending on your risk for open heart surgery. Surgical aortic valve replacement, most commonly called open heart surgery, is another option for treating severe aortic stenosis. Most open heart surgeries are performed through an incision across the full length of the chest, where your diseased aortic valve is removed and a new valve is sewn in. If you've been told you have severe aortic stenosis, only a properly trained, specialized heart team can recommend the best treatment option based on your overall health. Ask your doctor to refer you for a TAVR evaluation. To find a specialized heart team at a TAVR center near you, visit newheartvalve.com.
Patients include angina, heart failure. They do not occur until aortic stenosis is more severe. Pros and cons. Pros: this technique has already been worldwide adopted for inoperable and high-risk patients. Cons: too expensive permanent pacemaker implantation. Use applied in Ecuador. 100 patients with aortic stenosis were reported in the cardiology unit of Teodoro Maldonado Carbo Hospital. Clinical de Guayaquil established 7% of their patients with aortic stenosis. Male patients 65%, female patients 35%.
Aortic stenosis is a narrowing of the aortic valve in the heart. The aortic valve is the valve that separates the main pumping chamber, the left ventricle in the heart, from the body. So it's an important matter to have that valve narrowed or stenosed. Calcific aortic stenosis is common. In fact, the older a person gets, the greater chance is that they will have aortic stenosis. In fact, in 80-year-olds, there's probably a 10% chance that aortic stenosis exists and a 4% chance that it could be very serious. 2% of the population, furthermore, has a bicuspid instead of a tricuspid aortic valve. And in those people, there is a risk of aortic stenosis that is much higher than the general population. Aortic stenosis is underdiagnosed most likely because people have a way of denying symptoms. And it's a slowly progressive disease. So that means that someone used to walk to their mailbox at the end of the driveway, which could be 200 feet. And this year it's taking them longer, or they have to stop on the way, and they may have denied that that's happening to them, or just written it off to the fact that they're getting older. So the symptoms can be subtle. On top of that, when the patients visit their physician, the physician's trying to look at them from head to toe and think about things like cancer and heart disease all at once. And the murmur, which might at first be subtle, but eventually is not subtle, is left as a normal physiologic flow murmur. Aortic stenosis is undertreated. There have been several well-done studies to document this, the European Heart Survey and studies in the United States as well. And it may be for good reason. A patient who's 86 walks into their primary physician's office and they're elderly and frail, and he or she may hear a murmur, or obtain an echocardiogram, which is an ultrasound that looks at the heart and can diagnose aortic stenosis. And they may even have a discussion about whether they want to go the path of being evaluated for surgery. And if the patient's old and frail enough and has enough medical conditions, the decision may be that they're too frail or too elderly to go through surgery successfully. Even in elderly patients with severe symptomatic aortic stenosis, valve replacement returns them from a deadly survival path to the normal survival path. So the results of replacing a stenotic aortic valve, even in an 85-year-old, are very gratifying.
Conclusion. Checking assists cardiac and non-cardiac conditions if the diagnosis is aortic stenosis. Proceed to look which valve mechanism is appropriate. After begin pick the one solution value these patients the characteristic of this. Make formats and campaigns for providing important symptoms informate of aortic stenosis, for allowing informed shared decisions for patients with disease. Thank you.